Preston, who'd you hang out with from Harvard? Trevor DeRocher?
It's like Trevor Ray. My best friend since kindergarten. I didn't really hang out with him. I mean, I was friends with everybody, but on a regular basis, it was just my homies.
On the rig.
All right, sir.
Does this have to be powered on, or do you just go once you do 8 and then you can go? Cool.
You might be ready to doing this here. All right, Dan, anytime.
Okay. If you may or may not know, this is the UNO flag that's located at the clock tower here on campus. Now, you may or may not know with this flag that anytime that a retiree that's alumni from UNO, or that is also a current student or alumni or faculty dies, they lower the flag. You can actually just type in flag lowering on uno.edu or unomaha.edu and see that information for all the previous deaths that have occurred where they've lowered the flag. The reason I bring up the flag is that 1 in 4 adults are affected by mental illness, which you may or may not know as well. Suicide is also the 3rd leading cause of death nationally. Now, this information I received and retrieved is from the results of 2012 National Survey on Drug Use and Mental Health findings published by NAMI, which is the National Alliance on Mental Health. Now, the reason I showed you the flag and then gave you this information pertaining to the suicide rate and also 1 in 4 being affected by mental illness in the United States is because of the fact I want you to imagine this flag being lowered over the next, well, the rest of this week, because of that statistic of 1 in 4 people in this room that could potentially have their life taken by suicide for having mental illness down the road. Now, I can look out and just do a random, like 3 other people, but if that 1 in 4 statistic is true, which it is by statistics from that site I provided you, I'm the 4th person. I am the one out of that 1 in 4 from a random 3 other people that do have mental illness. So 1 in 4. I am a co-facilitator at the DBSA group here in Omaha. There's one at Morning Star Lutheran Church here at 86th and Dodge. If you take the left closest to the hospital and then you curve, I think, Leavenworth. It's not Leavenworth. There's a street that you take a right on, but there's a church over there on Thursday nights at 7 p.m. and it goes till 9. And then also Monday nights, I used to go to the Emmanuel Lutheran Church in Bellevue, which is on John Galt's, kind of in between like Village Inn and the Bellevue University. What I'm going to be doing here today is to make you all aware, first off, of the benefits and the repercussions to get or not to get involved with your community and finding support systems that are dwindling in the United States for mental illness people that are affected by many types of different diagnoses and disorders. I will also, secondly, guide you to find and give you information about choices by the information on why it's necessary to combat the media stigmatization that they use for language in all of news media. And then lastly, I'm going to stress the importance of recognizing that there is a problem, but with the help of many of you, it can be addressed also for you and your loved ones down the road in the future. Now, according to research done by Stanley Cohen and Jock Young in the published book, The Manufacture of News from 1973, now this is taken from page 190 there, they state that the ideas about mental health portrayed in the mass media are less correct compared to the expert opinions that are beliefs of the public at large. Now, when I'm discussing language in the news media, you might think of certain events like Sandy Hook Elementary, where there was the murder by Adam Lanza back in 13, December. There's also many other events that took place in certain military forts and countless other school shootings. Columbine is one, this from 1999. The reason I bring up language with this is that the news media does portray this in a stigmatizing way, as far as using types of language as deranged, dangerous, criminal. The suspects, they may have mental illness during these challenges and challenging times for the people that are affected by these tragedies. It's not helping the mental health community in any event. So that's why I wanted to bring up information regarding DBSA that I had spoken to you about previously. And also from the Journal of Postgraduate Medicine, Volume 60, Issue 2, from April of 2014. Now, the authors, Podley, Katana, and Sarkar state that media has also been suggested to be a risk factor for the genesis or exacerbation of mental illness, like eating disorders or substance abuse disorders. Now, the journal entry titled was Media and Mental Illness. I bring that up specifically to point out that it's not just the news media that's exacerbating this problem with stigmatization, but also the fact that there is drug abuse and drug substance, sexual addiction that occurs when people aren't getting the necessary help in the communities. And I bring up the communities in the DBSA group that I co-facilitate because of the fact that there are certain statistics that are occurring in the United States that are dwindling the mental health opportunities that we have to be a part of. Now, this is called the de facto system. This is from Liz Salvo's January 12, 2014 article, The Cost of Not Caring. There's Nowhere to Go from USA Today. Now, it shows that there are fewer hospital beds and inadequate community support services. With an estimated 590,000 as of today, about 500,000 in the 1950s. So it's growing and growing. De facto system basically is meaning that with fewer hospital beds and also inadequate community services, that estimated 590,000 mentally ill patients a year end up in the country's de facto mental health institutions, not actual mental health institutions that are by the year closing down on these people that are needing help. That's jails, prisons, city streets, and homeless shelters, and then also a morgue due to suicide. Now, the thing I wanted to lastly mention regarding the facts and figures that I'm obtaining here is Nebraska legislature. Now, I didn't cite this in my outline, so just be aware of that. NebraskaLegislature.gov website details that from January 14th of 2014, a legislative bill 887. Now, that's going to be a potential thing that they're going to be fighting to try and get enacted here for years to come, probably. All it would really do is provide 54,000 other Nebraskans that are currently uninsured coverage. So that way, this number can go down. Hopefully that number, by increasing the number of people insured, will also be a benefit. So that way, they're not resorting to homelessness, that they don't have beds available. They're going to have access to these community supports that we can hopefully, by the end of the speech, have the option and want to be a part of in our communities. Now here is UNO's flag once more. How many times do you think you can imagine in the next annual year that this would be lowered due to the statistics that you see and that I've shown you? Just for students here at UNO alone compared to the United States. And I'm going to tell you also as well what can be done to assist you, people in their need of care. From the student survey that received 21 surveys in total, it was split right down the middle. 11 of you stated that you don't watch the news on a weekly basis and that you don't trust the news. And then the other 11 said that you do watch the news on a weekly basis and you have a tendency to trust the news. I do want to point out that from Matthew Hansen of the Omaha World Herald last week on April 23rd of 2015, he goes on to quote Dr. Mark Vonnegut, which is the son of the late Kurt Vonnegut, if you're familiar with By Breakfast of Champions. He was a very famous author. Dr. Mark Vonnegut, he was at a presentation last Wednesday at the University of Nebraska Medical Center, where he's quoted as saying, doctors need to be honest about how they treat and mistreat patients, and that they need to be honest as well about the labels that they place on those with mental illness and the stigma that comes from those labels. Now, he also went on to ask himself in the article that was written last week, how do I stop the voices in my head from being so damn mean? Now, to quote, I didn't add the damn in there just because I like to curse. Now, the reason I mentioned that quote is specifically because Dr. Mark Vonnegut is probably the most recognized and best pediatrician in Boston, who just happens to be having been diagnosed with schizophrenia and bipolar disorder, dual diagnosis. He's also in a rock band and has written memoirs, and he's candid, very candid about his diagnoses as well. I don't feel like that's going on enough in the United States, where doctors aren't coming forward into community support places where I'm, especially a part of DBSA, where I'm the co-facilitator at. As well, the doctors, I feel, are kind of part of the stigma too, as well as the media with language, as far as the fact that they are afraid of repercussions of what may happen to them when they're tasked with being a part of groups such as this, where usually people that have been diagnosed with mental illness can go to for a safe haven and a place that's supportive for them and getting taken care of their needs by having support in other places outside of these communities, especially with hospital beds that I've shown you previously. That can be the case for everybody. It was certainly the case for me. I had been diagnosed with bipolar 2. There's quite a few different diagnoses for bipolar. With the DBSA, this is just their pamphlet that you can obtain either on Mondays or Wednesday or Thursday nights. It's their Better Together pamphlet. I'll just read a quick thing. Our mission here is to provide hope, help, support, and education to improve the lives of people who have mood disorders. And if I had never had the opportunity to be part of this group, and never had the opportunity to affect change in it, and have people make my life for the better, and hopefully vice versa for me to them, with these groups that are dwindling, there's no aid that can be given. There's nothing that can be done. And I'm a better person for having found these groups. I lastly just want to recap everything I've gone over with everybody, so that way we can actually make a determination for yourselves personally after the speech is over whether or not this is something you want to pursue. And getting involved in your community, making sure that I don't have to rip up another one of those, for example. But as well, I went over everything as far as the stigmatization of mental health and how that affects the media and us geared towards our society and communities for support. I also detailed it regarding the DBSA group that I'm co-facilitating on Mondays and Thursday nights. And I'm not trying to say that to get everyone to show up. This is just certainly for any of your loved ones down the road who you don't want to have to become a statistic. What you're going to be seeing is that with these potentials for suicide for people with mental disorders, I've been affected by it with many of my friends, and that's part of why I'm with the group currently. So just lastly, picture not the flag going down. Picture yourself happy, kind, doing the right thing, being a part of the community further than what you probably are now. Not to place judgment on the people, being able to take action and be supportive of the legislative bill 887 that is currently being fought. Get involved in the legislature, get involved with many of the other groups. There is information I can provide you for DBSA, the Nebraska Legislature, and also the Kim Foundation, which is just kimfoundation.org, where you can find out many other groups and support systems that are available in Nebraska. So I can be contacted at my email address here at dpolensky@unoomaha.edu. Thank you. I have questions. Oh, go ahead.
What was the name of that bill again?
Legislative Bill 887, I think it's called the Wellness Bill, simply, but I don't, yeah.
Dope. I'm gonna say dope.
So how long have you been involved with this group?
For about a year and a half.
And do you find it extremely productive or?
Well, it's challenging. You certainly meet a lot of people that challenge you.
That was
So.
Especially.